Welcome back. The number of confirmed measles cases in Limpopo now stands at 11. The ages of those infected ranges from 9 months old to 24 years. According to the National Institute for Communicable Diseases, 3 of those confirmed to be infected had been vaccinated for measles in the past. 2 have not, while the remaining 6 cases have an unknown inoculation history. Measles typically presents with fever, rash and 1 or more of these symptoms: a cough, red eyes and a runny nose. It can affect anyone of any age. For more, I'm joined by Nishi Prabdial-Sing, Principal Medical Virologist at the National Institute for Communicable Diseases. Thank you very much for your time this evening so we can get a little bit more clarity on this outbreak. First of all, 4 more cases confirmed just yesterday. Is this officially titled an outbreak, and are the numbers significant enough to warrant concern?
Yes, so this has been declared an outbreak since the 3rd case was detected. That's the definition of an outbreak, is that there should be 3 or more cases, 2 or more cases in a particular district within 30 days of onset. So that has already been declared an outbreak, and these 11 cases are on the rise since the 20th of October, where we just reported on the 4 cases, and now we're sitting at 11 cases.
So some of the positive cases were identified in individuals who've been vaccinated while some had not. Talk to us about the seriousness of the infections in these 11 cases and whether anyone has been hospitalized at this stage.
So at the moment, we only have information about the 2 of the 11 cases, that 1 had been hospitalized and 1 case had pneumonia. The others were just symptomatic cases. We're being isolated and we're taken care of at home. The kids that were vaccinated usually present with very mild disease initially, and they will recover perfectly.
Talk to us about the presentation of these cases amid a time when we've seen a drop in the number of people vaccinating their children for measles, either not vaccinating at all or only having gone for the 1 dose. And we know that that's amid the COVID-19 pandemic, where a lot of people avoided healthcare facilities. So just talk to us about what we can expect to see as a result of that.
So that's definitely one of the key facts that's driving the outbreaks, not only for measles, but obviously for other infections where the vaccinations are not up to scratching, and the vaccine coverage in districts and provinces are not high enough to protect the communities. So as a result, we're getting these outbreaks. And I think people need to just be aware of the symptoms of measles, as you mentioned: fever, rash, and 1 of the 3 cough, coryza, and conjunctivitis. And any child that's less than 5 years of age, or any adult greater than 20 years of age, should be aware that, if you haven't been vaccinated, measles can cause some serious complications, diarrhea and encephalitis and pneumonia.
So in the worst cases, measles can lead to brain infection, as you mentioned, encephalitis, blindness, and even death. So we have to take it very seriously. What is your advice to parents of children who have not yet been vaccinated or have not completed both those vaccination doses? Can children get their vaccinations up to date at any point in time?
Absolutely. It's never too late to vaccinate. We are encouraging all parents to check their road to health cards. We're asking schools and clinics to also do the same, so that all children should be vaccinated for the measles virus. The vaccine is available in clinics free of charge. Children should be vaccinated at 6 and 12 months of age for both to have a complete dosage of the vaccine. In the private healthcare facilities, they can have the MMR vaccine, which is a combination of mumps and rubella, and that's given at 12 months and 18 months of age. So it is imperative that parents should look at their vaccine cards and get their children to clinics as soon as possible.
So we know that this particular outbreak is located in the greater Sekhukhune district of Limpopo. Is that an isolated incident, or are there other incidents of measles occurring elsewhere in South Africa at the moment that parents should be aware of?
So yes, there are isolated incidences occurring throughout South Africa. And I think parents should be very aware that measles can spread very rapidly. The reproduction rate for measles spread is one person can infect 12 others. Especially if they are susceptible. So it can move from the Limpopo province to other areas in the country. At the moment, it has been moved, we have seen cases coming up in other districts in Limpopo. And there's these isolated cases that are occurring in other parts of the country.
So while you said earlier that vaccinated children or adults present with very milder symptoms and that they should recover quite easily without any sort of damage to their health in the long run, we're looking at a percentage of 95% for herd immunity. Talk to us about what that means in terms of vaccination rates currently and what we could see happening if we're not quite at those levels.
Exactly. So at 95%, so that means that 5% of the community has the chance of getting the measles vaccine if 95% of the people are vaccinated. So what that boils down to is that the higher the vaccine coverage in the area, the more people are protected, and that prevents the transmission and replication of the virus in a community that's well protected. So that we should aim to increase our vaccine coverage in all the provinces in South Africa. At the moment, there are provinces like Limpopo that have been sitting at 60% over the past couple of years. And we really do need to encourage vaccinations in children in these areas so that we can up the vaccine coverage, protect more people, and get less susceptible people to spread the virus in these communities.
Of course, we know that there are certain groupings of children who are immune compromised, for instance, who may not be able to get vaccinated, who may be at higher risk of both contracting something like measles, coming into contact with other children at school, and then possibly even developing more serious symptoms than someone would who is not immune compromised. What's your advice to parents of children in those circumstances?
So yes, the vaccine, the measles vaccine, is a live virus vaccine. It's attenuated, so that means it's a weakened form of the vaccine. It shouldn't be given to children that are highly immunocompromised, even in adults that are immunocompromised and pregnant women. So those are the individuals that should be isolated from a measles case immediately. If there's an outbreak in schools, they should be informed. Parents should be informed and keep their children at home. It's not advisable for them to mix, in large groups of people, especially if there's an outbreak declared in a particular area.
Well, thank you very much for speaking to us and for all those very valuable details. That was Nishi Prabdial-Sing, Principal Medical Virologist at the National Institute for Communicable Diseases.